Hello doctors, welcome back to Docshala. So today in our video we are going to see about an important cyst, that is odontogenic keratocyst. Okay, so what is odontogenic keratocyst? It is nothing but a rare and benign but locally aggressive developmental cyst. Okay, rare, benign and locally aggressive. Okay, so most often it affects the posterior mandible and most commonly presents in the third decade of life, that is after 30 years of age. Okay, so odontogenic keratocysts make up around 19% of the jaw cysts. So this is like somewhat rare but make up around 19%. So actually odontogenic keratocyst was also reclassified as keratocystic odontogenic tumor by WHO. So from 2005 to 2017 it was known with the name KCOT, but after that due to its clinical entity it had been for years as odontogenic keratocyst only. So it was reverted back, okay, after 2017 to OKC back. Okay, so whenever a question is asked whether KCOT or OKC, both are same. Okay, so don't get confused between these two. So KCOT was it was KCOT from 2005 to 2017. So it was named like this by WHO and IRC. Okay, and coming to the signs and symptoms that we see in OKC patients are, it can occur at any age, so there is no age predilection. So however they are more common in the third to sixth decades. Male is to female ratio is 2:1 and the majority are found in the mandible. Okay, half of them occurring at the angle of the mandible. Okay, so early odontogenic keratocysts do not display any symptoms. Typically, clinical signs and symptoms present with bony expansion or infection. So, bony expansion or infection is the typical clinical signs that we see in OKC. So, when symptoms are present, they usually take the form of pain, swelling, and discharge due to secondary infections. So, odontogenic keratocysts are usually noted as incidental radiographic findings. Okay. Radiographically, they can be seen as unilocular or multilocular radiolucences. Okay, then so these are the radiographs. You can see a unilocular cyst here. So this is the close-up of that cyst, right? So this is how a OKC looks like. Then, so coming to the diagnosis is usually incidental radiographic findings. So apart from that, a definitive diagnosis is through biopsy. Okay, so biopsy is the definitive diagnostic category for OKC. So the aspirational biopsy, so it is performed like this, is contains a greasy fluid which is pale in color and contains keratotic squibs. So this is the fluid that is displayed here in this syringe. Then, okay, coming to the radiographic diagnosis. So the radiographs show well-defined radiolucent areas, as you can appreciate in this image. So with rounded or scalloped margins which are well demarcated. So the margins are well demarcated. So they can be multilocular or unilocular. So the growth pattern of lesion is very characteristic, from which a diagnosis can be made as there is growth and spread both forward and backward along the medullary cavity with little expansion. Okay, so there is no resorption of teeth or inferior dental canal and minimal displacement of teeth is seen. Okay, so teeth are not affected, no resorption, nothing to dental canal, nothing. So the cyst is unilocular or multilocular. So growth and spread is forward and backward along the medullary cavity. It grows along medullary cavity alone. So expansion is little. So the NEET MDS question that they have asked is, so a radiograph shows anteroposterior radiolucent swelling, so with less buccal or lingual expansion. Less buccal or lingual expansion is the main keyword that they have given here. So which of the following would be probable diagnosis? So buccal and lingual expansion is less. Okay, so dentigerous cyst, ameloblastoma and CEOT, they show a minimal minimal to minimal expansion of the bone, okay, except for keratocystic odontogenic tumor, that is they have given it as KCOT or OKC. Okay, so this is the answer. If you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at Docshala for dental content and at Docshala Medical for medical content. You can also follow us on Telegram. Thank you.